Assalamu alaikum everybody. Today my topic of discussion is depression. It's a very common and sensitive issue nowadays in our society. So please watch my video till end and find out what I'm going to talk about. And I was, listening like you guys about depression, for so many days, for such a long time, and I even heard about that and I read about that, and it was totally not satisfactory in my opinion. That's why I'm here today, and I want to tell you guys what depression is in fact. What I want to change your approach towards the depression and perception about the depression patient in our society. It's very painful that I heard so many religious scholars and motivational speakers, and they were all having very negative and wrong approach towards this disease, and they have very wrong point of view even, and they are talking about this again and again, and they are just imposing their thinking, and people are also thinking in that direction. According to them, they think people who are going to be the victim of this disease are thankless, selfish, self-centered, negative, away from their religion. They are not true Muslim. They are away from their ibadah. They don't believe in Allah, and they're in habit of complaining. They're lazy, and they are negative people having pessimistic approach. So that's why, because they're negative thinker, they are critical, and so they are very that kind of people are going to be the victim of this disease. So I just want to change first of all this perception. It's a wrong perception. There is nothing like that. These are not the natures which are going to involve into the depression. Depression is beyond these all things. It's nothing to do with depression. Normal, happy, jolly, lovely, dedicated, devoted, intelligent, and sincere, honest, a good normal human being, good Muslim, and the person who believe in Allah, who believe in all their situation, and who is thankful, uh, everybody in that way can be the victim of this disease. First of all, change your thought. A normal person can be the victim of this disease. This is why people are not going to discuss about their disease. They are not going to discuss about their situation to their family, friends, boss, office, in their circle, because of this wrong judgment. They feel that that society and our friends and people around us are not going to accept us in this situation, and they will not support us, and they will start judging us, and that's why they feel ashamed, and that's why they don't want to go to the psychiatrist. They're not going to get their treatment because of these negative labels and negative thinking. People are scared of even expressing their feeling, what they feel. Even it's not concerned with this kind of nature. It's really something else, because the person who are having the vitamin D deficiency can be the victim of depression. The person who is not having proper sunlight can be the victim of this the person who is having extra workload, the person who is thankful to Allah and all the time, but he is fighting with his daily routine, and he has a workload, and he is trying to adjust in that situation which is not according to that. Even happily he is doing that, and the person who is trying to give his 100% to the family, to the office, and to the every task which is given to him, can be the victim of depression. A good Muslim, a true Muslim, a true religious person, a true believer can be the victim of this disease. Please change this perception. It's totally wrong. Secondly, why I'm here, my sister was suffering with this disease, and she was an awesome, and alhamdulillah, she is an awesome human being, and she was the victim of this disease. And that time I came to know these all things are very wrong, and these are very wrong judgments. People who are not suffering with this, they are just imposing their thinking and their point of views about this disease. For God's sake, stop doing this. Stop doing this. Depression is beyond this all. You feel something else in depression. At that moment, we went to the different sites, we went to different lots of things we were reading in that phase and watching, but we didn't find any data about depression properly. There was only few symptoms, that was loss of appetite, loss of sleep, and low feeling, sad feeling, and crying. These were the symptoms mentioned everywhere, and there was nothing more than that. When brain is organ like other organs, so it can be sick like other organs, and it should be treated like other organs. So we were in that phase, either we are suffering with depression or not, and for that thing we have no detailed and clues and ideas and symptoms over there, because when brain is not working, definitely it will affect your habits, your thinking, your emotional state, and we wanted to get that kind of data, and that was not available everywhere. Even we heard so many celebrities interviews, and the people who were once having this disease and now they're fine, but they even didn't mention. I know it's difficult to recall that painful experience, but they didn't mention anywhere who was the doctor, what was the treatment, how they felt, what were their emotional state in that phase, and how they were dealing that, what they were feeling in that way, what they were doing, how they got rid of this thing, and what was that phase kind of. So people can relate, people can find the track, so they can follow and they can find out what they're dealing with. So we have to help these patients to find out. So many people, they're not even accepting that they're suffering with depression, but they are suffering with depression. In my next video, I will try my best to tell you guys the symptoms and signs of actual depression is. So please change these all things. Please try to help people, accept people that they are not mad, because it's not congenital, it's a disease which can be treated, and it's very normal. It's not congenital disease, it's not personality disorder that you can label them that kind of stuff, that they're no mad. No, depression people can be treated. It's just a phase, and it's a disease which if it's a disease, it can be over after some time, and it will be fine. But the need is that you guys have to tell them and encourage your patients around that go to the doctors, get their treatments, and support them and show them they are not mad people. These are not kind of personality disorders and that kind of difficult diseases. They are not going to get treated, or maybe a bit treated, but depression is totally curable. And let them know that what actually depression is, and help them to get rid of this, because